Good morning and welcome to New You Today. I'm Abby Kay, and here with me this morning is Dr. Bill Alison of Dunagan, Yates and Alison Plastic Surgery Center to talk about facial surgery. Good morning, Dr. Alison.
Good morning. Happy to be here today.
Good to have you. Well, there are two types of facial surgery. There's cosmetic and there's reconstructive. Let's start with cosmetic. Give me some of the common components of a total facial rejuvenation.
Well, the idea behind total facial rejuvenation is to add symmetry to the face, to do the whole face so that you don't have a mismatch of the upper face looking bright and new and the lower face looking old. So what I do when a patient comes in is I look at their face starting at the brow, the eyes, I go to the cheeks, I go to the folds around the mouth, the neck, the chin. And so when you look at the whole face, you can determine what each patient needs. And sometimes it's surgical, and sometimes it's even non-surgical, like other things like Botox and fillers. And sometimes in combination, you do the brow lift and the eyes for the upper face, and you use Botox and fillers for the lower face. So everybody's individualized.
Okay. Well, now this patient here has had her total face done. Can you tell us about her?
Yes, and I appreciate this patient allowing us to use her photographs. We couldn't be on this TV show without their approval. So she's had all these procedures done. If you look at the pre-op photo there, she has a drop in her brow. She has the extra hooding of her eyes. She has bags under her eyes. She has those folds around the mouth. She has jowling. She has looseness to her neck. So with total facial rejuvenation, you do a brow lift, you do eyelid surgery, you do the facelift, which can give you a cheek lift, you do the neck lift, which takes away the jowls and the looseness of the neck. And so with all those procedures combined, and probably fat grafting of the lips and those kind of things, you can get a really total rejuvenation so that you don't have that mismatch that really is distracting.
Okay. Well, how important is a good skincare program at home?
Oh, well, that's kind of the base of everything we do. When I make you look really great with a facelift, I want you to stay that way. And sometimes the skin is really the first thing you see. So with the skincare, it can decrease your aging changes by up to 20% in some people. And so it just keeps you from aging. It improves you, and then it maintains that level of nice skin, smoothness. And that can be skincare alone, products, and then some gentle peels and things of that sort.
Well, the other type of facial surgery is the reconstructive, and one type of situation is the babies with the cleft lip. How do you help these children?
Well, that's a perfect example of why we as plastic surgeons feel that we're uniquely trained to do cosmetic surgery, because we've spent so much time doing reconstructive surgery. And when you see these pictures of the cleft lip, that's devastating to the patient. And so in the techniques that we use to repair cleft lips and palates and other facial injuries, we use those and take those techniques to cosmetic surgery.
And this picture shows it all. This picture is absolutely amazing.
Yes, this young lady obviously is devastated. The family's devastated. You can't function in society today like that. So with essentially rebuilding the lip, you can make a permanent change for them. And yes, there are other procedures this child will have to have over time. But I think in this one photograph here, you can see that that's a dramatic improvement.
It is a dramatic improvement. You're right about that. Well, thank you, Dr. Alison, for joining us. And thank you for joining us on New You Today. If you have a question for Dr. Bill Alison, you can contact him at Dunagan, Yates and Alison Plastic Surgery Center. Their number is 536-4448. And do request a free patient information booklet as well. Or you can visit them on the web at DYAplasticsurgery.com. Thank you and have a great day.
Thank you.